listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, review our checklist of steps to help you get certified, organized, and ready to serve clients. Steps to get ready for OEP, federal and state exchanges, written by Emily Ryan. As the open enrollment period approaches, there are several steps that agents should take to be ready to sell. Today, we'll be focusing on the steps that agents new to the industry need to take. These steps are mostly the same for returning agents, with a few differences. We'll mention those when applicable. Additionally, preparing for the open enrollment period, OEP for short, can be different based on if you're selling on the federal or state exchanges, or both. We'll note these differences as well, so you can be prepared to sell on both exchanges. To help you keep organized, we created a printable OEP ready-to-sell checklist. You can find the link to download that PDF in the episode notes. Now, let's get into the steps. Starting at number 1, complete the FFM certification and state training in early August. All agents selling Affordable Care Act, ACA plans, are required to complete certification or training, depending on which exchange they're selling plans in. For the federal exchange, agents are required to complete the Federally Facilitated Marketplace Certification, FFM certification for short. Each state-based marketplace has its own training. If you're an agent only selling in one exchange and not the other, you'll only need to complete the training for your exchange. Looking closer at the Federally Facilitated Marketplace Certification. New to the marketplace agents will have to complete the full version of FFM certification. Agents can complete this training through the CMS MLMS platform or an approved vendor. Those who have previously completed the FFM certification are able to take a condensed version of the training. You'll be automatically enrolled in this condensed training if you've successfully completed training from the plan year prior. Next, state-based marketplaces. State-based marketplaces, SBMs for short, are operated independently by the state, rather than overseen by the federal government. Agents enrolling clients residing in SBM states must complete training through the state's platform. Training start dates, deadlines, and links vary by state. OEP dates may also differ in some states. The SBM's Ritter Insurance Marketing currently works with are Maryland Health Connection, getcoverednj, Penny, and Virginia Health Benefit Exchange. You can find more resources about state exchange and FFM certifications in the episode notes. Moving on to number 2 on our checklist. Complete carrier contracts during the summer. Before selling ACA plans, agents and brokers must contract with carriers available in their marketplace within the states they're licensed to sell these products in. As a Ritter agent, you can complete carrier contracts within the Ritter platform in just a few steps. Step 1. Log into the Ritter platform. Step 2. Select the Contracts tab. Step 3. Click Contract Now. Step 4. Select Under 65 as the product. Step 5. Select the states that you're approved to sell in. You can also reach out to our team of sales specialists for assistance or recommendations for your market. If you don't already have their contact info, we'll link to that in the episode notes as well. Completing carrier contracts allows you to have a full portfolio of products for a variety of clients in your book of business. Consider adding carriers that offer benefit-rich plans. Ritter has many to offer. Number 3. This is something you can work on all year long. Sharpen your ACA knowledge. To properly advocate for and serve your marketplace clients, we recommend becoming familiar with the products in your portfolio and how the exchanges operate. We've created a number of resources and training opportunities to help agents get familiar with this line of business. We built a Surviving OEP page. This central hub has all the information you need to prepare for OEP, including categories of helpful blog posts and other resources. We update this page throughout the year to include information relevant to agents during the OEP and post-OEP. Next, the Under 65 Health Products page. Our Ritter Docs page hosts information about each product's carriers, certification information, and other helpful notes for agents. This page gets updated frequently to keep you up to date. Ritter also hosts webinars and in-person events. Here, product and industry professionals share their knowledge live or on demand. Take advantage of the free ACA ebook. Download our comprehensive guide that explains what you need to know about the ACA and how to master the market. Learn on your own time with Night School. Self-guided online modules for training and education are available whenever you are. The Ritter blog. We're constantly adding new posts about a variety of topics and newsworthy updates. And of course, what you're listening to right now, the ASG podcast. We publish 3 episodes a week at minimum, everything industry related, from sales strategies to breaking news. Be sure you're following along with us. Number 4. Market yourself before October. The next step of OEP preparation is making sure potential clients are aware of your services. Increase your sales by connecting with existing clients and marketing your business to new clients. Some carriers have marketing materials available for agents to use. These can be either carrier-specific or generic, so you're sure to find something that works for you. You can find these resources on most agent portals on carrier websites. We recommend getting in touch with your local community. You can easily meet in person after all. Since your clients are under 65, most of them are also online. Use social media and other digital resources to share your business. You can also participate in healthcare.gov's Find Local Help, also referred to as Help on Demand. To participate in this program for federal exchange states, agents must complete their Help on Demand training course after completing the FFM certification. This supplementary training is brief and educates agents on how to take advantage of the tool. To add your information to Find Local Help, follow these steps. Number 1. Create an account with the CMS Enterprise Portal. If you already have an account but haven't used it recently, you may need to renew your account for the upcoming plan year. Number 2. Identify yourself as an agent or broker by selecting Request Access Now, then choosing the FFM/training agents/brokers/assisters title page, and then selecting FFM Agent Broker from the drop-down menu. Number 3. Confirm your identity by following the prompts on the page. Number 4. Complete the Help on Demand training and sign the privacy agreements if you haven't already. Number 5. Confirm that your national producer numbers are listed as valid on the Agent and Broker FFM registration completion list. Number 6. When completing your profile, you'll be asked if you'd like to be displayed on the Find Local Help page. Select Yes. Lastly, number 7. Enter your information and click the Save/Update button. CMS will then verify your information and you can move forward with finalizing your Find Local Help page. Use the Help on Demand training and registration guide to get in touch with potential clients. We have it linked in the notes for you. Most state marketplaces provide an option that's similar to the federal program. Check with the exchanges that you're selling in for their option. Then familiarize yourself with their requirements to participate if you're interested. And now, number 5 on the checklist. Start selling ACA plans on November 1st. With OEP just around the corner, it's time to start meeting with clients and finding the right plan for them. If you can, discuss coverage options with your clients before November 1st. Help your clients find healthcare that suits their needs. Federal exchange clients can enroll through Health Sherpa, another direct enrollment partner, or healthcare.gov. Clients in SBMs will enroll through their state's marketplace platform. Consider core coverages as well as supplemental coverages, such as marketplace dental plans, which can be sold during the OEP. Once you complete this checklist, you'll be in a good spot to start OEP off strong. Don't forget to get your digital download and check out all the resources mentioned in the episode notes. If you have questions, want product details, or contracting assistance, get in touch with your Ritter sales specialist or email the podcast at asgpodcast@ritterim.com. Thank you so much for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Emily Ryan, script proofing by Sarah Ruppel, recording and production by me, Tina Lamoureux, podcast design by Urban Rivera, artwork by Vivian Zhao. Follow along with our show wherever you like to listen.